Ever wondered why there are so many misconceptions about disability claims and medication side effects? Well, let's clear the air. You see, when it comes to disability claims, it's not just about the side effects of medication. Sure, they can be disruptive, even debilitating at times, but what really matters is the severity of the underlying impairment. That's the crux of the matter. Now, you might think, but the strength of my medication surely must count for something, and you'd be right. The type of medication can indeed serve as strong evidence of disability. Yet it's important to remember that it's not the only factor in play. It's a piece of the puzzle, but not the entire picture. Strong treatments like radiation or chemotherapy, for instance, could lead to a finding of disability due to their well-known and universally credible side effects. So the side effects of medication, as disruptive as they might be, are not the sole determinants of a disability claim. So what role does medication play in disability claims? The answer to this question has multiple layers. Medication, in the context of disability claims, is not merely a tool for managing symptoms. It can also serve as a crucial piece of evidence in assessing the severity of an individual's impairment. Picture it this way. Medications are like specialized keys designed to unlock specific doors. The more complex the lock, the more intricate the key required. In similar fashion, the type and strength of medications prescribed can offer insight into the complexity and severity of the underlying medical condition. This, in turn, can be strong evidence of disability. For instance, a person prescribed powerful painkillers for chronic pain might have a more severe impairment than someone taking over-the-counter medications for the same condition. The strength of the medication can reflect the intensity of the pain and thus the extent of the impairment. But here's where it gets a bit tricky. Not all strong treatments, like chemotherapy or radiation, automatically lead to a finding of disability. These treatments are indeed potent, and the side effects associated with them can be debilitating. Yet, the Social Security Administration doesn't grant disability status based solely on the strength of your treatment. This is because disability claims are not about the treatment you're undergoing, but rather about the impairment you're living with. The focus is on how the impairment affects your ability to work. Even with strong treatments, if you're able to maintain gainful employment, you might not qualify for disability. What's more, the administration also takes into account how long the impairment is expected to last, and how long the individual has been unable to work. It's a comprehensive evaluation process that goes beyond just the type of medication or treatment. So, while the type of medication can indeed be strong evidence of disability, it's important to remember that it's not the only factor considered. The full story of your impairment, your ability to work, and the expected duration of your condition are all vital pieces of the disability claim puzzle. Remember, the type of medication can be strong evidence of disability, but it's not the only factor considered. Then, when do medication side effects matter in disability claims? It's a question that often comes to mind, especially when dealing with severe health conditions. To answer this, let's delve into specific cases where medication side effects can significantly impact disability claims. Picture this. You're undergoing chemotherapy or radiation treatment. These are heavy-duty therapies, and their side effects are not just universally credible, they are also widely recognized. We're talking about extreme fatigue, nausea, hair loss, and even cognitive issues. These side effects are so severe, they can inhibit a person's ability to perform daily tasks, let alone work. Now let's say you've been prescribed a medication for a chronic condition, and the side effects are causing you significant distress and impairing your ability to function. In such cases, the side effects of your medication might be seen as an extension of your underlying condition. However, it's important to bear in mind that it's not just about the side effects. The Social Security Administration is keen on understanding the overall severity of your impairment. The type of medication you're on can be a strong indicator of this. For example, if you're on a potent medication, it could signify that your condition is severe enough to warrant such a treatment. But here's the catch. Simply experiencing side effects from medication isn't typically enough to win a disability case. It's the cumulative impact of your condition, the strength of your medication, and its side effects that will be taken into account. So, The type of medication you're on, the side effects you experience, and the overall severity of your impairment all come together to create a comprehensive picture of your disability. It's like a puzzle where all the pieces need to fit together to provide a clear image of your health situation. It's crucial to understand that while medication side effects do matter, they are considered within the context of the overall severity of the impairment. So while your medication side effects are a piece of the puzzle, they are not the whole picture. So what should we take away from this discussion? We've journeyed through the complex landscape of disability claims and the role of medication within them. It's a winding path, filled with nuances and subtleties, but there are some key points that can guide you like beacons in the night. Firstly, medication is a significant player in the game of disability claims. Its role is not to be understated. The type of medication you're prescribed can serve as potent evidence of the severity of your underlying condition. This is because the strength of your medication often mirrors the intensity of your ailment. However, it's crucial to remember that the side effects of medication, while often burdensome and challenging, are typically not sufficient on their own to win a disability claim. It's not about the side effects themselves, but rather what they signify. The side effects are like signposts pointing towards the gravity of your impairment. That being said, there are exceptions. Some treatments, like radiation and chemotherapy, are so potent that their side effects are universally recognized as severe. In such cases, these side effects could indeed tip the scales towards a finding of disability. This is not a general rule, but rather an exception that underscores the importance of context and the individual circumstances of each case. In navigating this terrain, it's essential to keep in mind the difference between the side effects of medication and the severity of your impairment. The former are indicators, signposts if you will, while the latter is the destination itself. The severity of your impairment is what ultimately determines the outcome of your disability claim. So, while medication and its side effects are important factors, they are part of a larger narrative. They contribute to the story of your health condition and its impact on your life. Remember, the goal is not to focus solely on medication, but to understand how it fits into the bigger picture of your health journey. In the end, understanding the role of medication in disability claims is about understanding the bigger picture of your health condition and its impact on your life.